Hi, thanks very much for joining me again today. I'd like to say a little bit about positive therapy, which is the practical application of positive psychology in the therapeutic field and for the issue of behaviour and emotion change. I wanted to say a little bit about this in connection with our certificate in resource based therapy that we're running here at SDS at the moment. And I really wanted to highlight three key things which I think that positive therapy actually offers, which are not around, I think, in a lot of traditional ways of actually helping people. So I'm going to take you through three key points, which we're obviously going to be expanding on in quite a bit of detail in this particular module, should you choose to sign up for it. But I thought I'd give you a few ideas about the sorts of things that we'll be doing during this particular period of time within the course. First of all, the key thing, I guess, to bear in mind about positive therapy or positive psychology, which is not surprising given its name, is its focus on thriving. Its focus on what enables psychological well-being, what enables people to thrive, what enables them to develop particular strengths and virtues that they might have and to be more successful in their functioning as a result of that. And that particular focus, I think, offers something which is often missing from a lot of other approaches which are about helping people to change, which is the absence of the focus on a problem. The absence of the focus on a problem. Now, you and I are working with people who have a whole variety of problems, and that's the reason why they've actually come to see us. Whatever those problems are, whether we're helping people who are depressed or anxious, or whether they've got problems with their anger, or whether you're trying to help them to stop smoking or to change some other type of health behavior, or whether you're trying to look at reducing school non-attendance, or whatever it is that we're actually doing with our clients, it's typically about trying to erase a problem. And that there's two particular difficulties with this, which not always, but sometimes crop up. The first one is that very often we will be working with people who don't think they've got a problem at all. Or certainly they don't agree with us about what our definition of the problem actually is. And that immediately creates difficulties in terms of trying to work with them if we've got a very problem-focused way of working. Secondly, there are people that we'll be working with who know they've got a problem and agree that they've got a problem, but basically, for a whole variety of reasons, don't feel that they can actually address or overcome that particular problem. One of the nice things about positive therapy is it bypasses that difficulty altogether. By not being problem focused and by focusing instead on what enables people to thrive, we don't have to get into that sort of cul-de-sac discussion and issues of resistance which we often think crop up when we're working with many of our clients. And there's a lot of evidence to suggest that by encouraging our clients to do particular things which enable them to thrive, then the types of problem that they actually have automatically diminish without actually having to focus on the problem at all. So that's one particular advantage, I think, of this particular approach, which is contained within our certificate on resource-based therapies. The second advantage with this particular approach is that it has a mixture of both teaching people new skills, which is great, but also about helping people to identify what it is that they already have and encourage them to use that in a more skilled way. Now, I'm a great believer in the idea of teaching people new skills and giving them new information. But you and I both know that we work with many people who basically don't want to learn, or they find it difficult to put things into practice, etc. So very often it's useful instead to approach things in a different way. And one of the things that positive therapy offers are some interventions and techniques which are not about teaching people new things. Instead, they're about identifying what the individual already has and looking at ways in which they can express it in either a more constructive way or alternatively within new areas of their life. So we immediately again bypass that difficulty that often crops up with clients of resistance in terms of trying to teach them a new skill. The third advantage with looking at positive therapy is it addresses a perennial issue which I really don't think is highlighted sufficiently in a wide range of problem areas, and that's the issue of relapse. We know in practice that relapse is extremely common with a number of different types of problems that we're working with people on. Again, whether we're talking about changing health behaviours, losing weight is a classic example of this, where very often the difficulty is not necessarily helping people to lose weight, it's about enabling them to maintain it because people frequently relapse. We know, for example, relapse is very common in depression, and it also crops up with a number of other difficulties that we're working with people on. Now, I think genuinely that one of the reasons why relapse occurs for many people is because the problem that they've had has dominated their life very often for a very long time. So when we do work with them, which helps them to shrink that particular problem, so it becomes a less dominating feature in their life, very often people are left with a vacuum. They're left with a gap which has got nothing to fill it. And unfortunately, because nature abhors a vacuum, very often people look to fill that vacuum in some particular way. And what's the most readily available thing to do that? The return of the problem. People naturally return to old ways of doing things, they naturally return to what is familiar in order to actually fill that particular void. One of the great things about positive therapy is, again, it bypasses that issue. By focusing on developing alternatives, what this actually does is that it enables people to change in a way which shrinks their particular problem, but on the other hand, it automatically provides alternatives which fill it and which have a big impact on relapse. So this whole model of approaching things in a different way, using this positive psychology approach, we think is a key element in our certificate in resource-based therapies, and we look forward to being involved with it with you. Thank you for your time.